Hi, everybody. I'm Sara Gold, and I'm the director of Michigan No Kid Hungry, which is a public-private partnership to end childhood hunger in the state of Michigan. And we at the United Way for Southeastern Michigan serve as the lead nonprofit partner in that work. And Melissa asked me to talk about the how, not the what and not the why of our work. And so I'm not going to sit here or stand here and talk to you about how we've helped many partners in Southeastern Michigan and in the state to serve many more meals to kids through federally reimbursable child nutrition programs. But we have done that, and we're very proud of all the progress that we've made, and we're working to close the gap between those who are eligible and those who are receiving those meals. But the how, I sat down and I started to make a list of tactics to try to explain the how of what we do in this partnership. And I wrote things down like plan for quick wins, but long-term success. Change is very frustrating and slow. Invite people into the room. Listen first, then speak. Build inclusive partnerships. And my list went on, and I realized that what I ended up with looked kind of like a superficial list of platitudes. And I wasn't sure how I felt about that because I'm really proud of our work. But then I realized as I sat there and I thought about why I had a negative reaction to what I feel is very important work. And what I thought about actually took me back to my core training as a social worker, which is the way of thinking that I hail from. And the first thing that you learn in social work school is to start where your client is. And from an interpersonal standpoint, this means that in a therapeutic relationship, even if your client is only ready to talk about how annoying his or her boss is, but you know that he or she is probably there at some point to talk about a childhood trauma, that's not what you say. You sit there and you listen to them talk about their boss, and eventually, if that's an effective therapeutic relationship, you get to that childhood trauma, and some of it becomes resolved, and the person becomes freed of whatever that trauma is causing. I am not an interpersonal social worker. Nobody would want me to be one. I like to work with systems and organizations, but I think that the same beginning point rings true. You start where your client is, and client can be a term that you insert whatever it is that you're working on becomes your client. And so to explore that a little bit, I have a story that also illustrates some of the work that we do. In 2012, which is the year that the United Way kicked off its partnership with the national organization Share Our Strength and launched our No Kid Hungry campaign here in Michigan, we started planning, and we had incredibly motivating and inspiring conversations about transforming the child nutrition system in the state of Michigan and bringing all of these amazing partnerships into fruition and getting state systems to talk to each other. And if somebody will fund this, we can make the changes that we all know are possible and needed in the state to feed all of the children who are in need of nutritious food and to not be hungry in our state. And so we planned and we put lots of thoughts down on paper. And then we received a call from the Michigan Department of Education. About 4 weeks, maybe it was 6 weeks, but I'll say 4 for dramatic purposes. Before the summer of 2012, we found out that the then department in the city of Detroit that administered the summer meals program, which was comprised of about 200 sites where kids got free meals, no questions asked, every day during the summer when the school was no longer in session and not providing school breakfast and school lunch. That organization was about to lose their ability to run the program. And so in a flash, overnight, those 200 sites were going to disappear. And here we are, on the one hand, launching this amazing No Kid Hungry initiative in our state, transforming the way that children access these federally reimbursable meals. How lucky are we to work on a program that is already federally funded, and all we have to do is connect people to these programs. And here's our first challenge. Here's our crisis. No more program in the city of Detroit. And so a conversation about that transformational change changed into how do we actually just hold the line and make sure nobody misses meals that existed last summer. And we invited partners to the table. We invited the organizations that were already involved in the program. We put a map up on the wall and said, here's 200 sites. We better figure out how to cover them to make sure that children don't lose access this summer. And we're going to have to put transformational change on pause for now. We worked really hard that first summer to cover those 200 sites and to build new relationships and to invite new people into the room and to work with a state agency that wasn't necessarily always used to coming down to the community level and figuring out how to solve a problem like that. And I'm proud to say that we did hold the line, and we made sure that those 200 sites, or close to it, stayed open, and that kids had access to meals that summer. And a lot of the folks who are a part of that are in the room here today. And it was that crisis that caused us to bring new partnerships into the room and to start where the client was, to start where the city of Detroit was. And since that day, we've held the line and we've grown every single summer. More meals have been served, more partners have come to the table. The collaboration has become stronger. You might know the program now as Meet Up and Eat Up, which has a whole new name, it has a whole new frame in the state of Michigan. And like I said, the number of meals served has grown since 2012 each year. The city of Detroit was our client. We started where our client was. It's the same story as we try to expand school breakfast in school districts. We start where the schools are. Schools do a lot. Asking them to do more and serve breakfast in a different way by moving it outside of the cafeteria to make it more accessible is difficult for them. And the list goes on and on. All of our work. We figure out who the client is and we start there and we build. So I thought back after thinking about that story, thinking about this list of platitudes, thinking about my social work training, and I actually have to say that because of doing the prep work to stand here and tell you this story, what first seemed like a list of platitudes and some notes I had taken in my notebook in social work school actually have formed the foundation of what I feel is really good work and work to be proud of. And so the ending thought that I'd like to leave you with today is that simple is okay. Going back to the foundation is okay. And starting where we are and building on strengths is okay.